All right, so I'm going to go at this a little bit differently than Dr. Patel did because of my background. We are actually working, I'm with Dr. Apley, and so we're working on one of the FDA cooperative agreements. It was awarded to 4 of the protein groups. We are working on the dairy and beef portion, and we're strictly looking at feedlots at this point, and the dairy is cows on or at milking herds. They're not looking at heifers or anything like that. And then Dr. Davis, Peter Davies, and Dr. Singer are looking at the swine and poultry, respectively. So the project overview for our beef feedlots and specifically, we didn't really have any requirements. We were just looking for people that would be willing to collaborate with us. This is a fairly sensitive subject, as a lot of us know. People get concerned about how the data is going to be used, what's the goal, and we're just strictly looking at, use data at this point. And so we didn't have any requirements on size. We didn't care if they fed out 1,000 head of cattle per year or 150,000 head per year. No requirements on record system types. They could have kept track of their treatment records on a note card or in a spiral-bound notebook. We have, potential for economic disappearance, so we're looking at sales data that they purchased from their clinic or somebody else. Some of our farms would have on-farm management software that may or may not have download capabilities, so that we could access it in a spreadsheet. And then some data would come from an intermediary management group, sometimes a consulting group, sometimes just a data management system. So when we're looking at capturing our use data, some of you may be familiar with this chart. It tends to float around in our group fairly frequently. And so on your left, we're going to see what we would like to have, and then on your right, we're going to see what we would really not prefer to have. And you'll see as I go down that sometimes we can't always get what we want. So we're going to have coupled to cause and not coupled to cause. And basically, do we have why they used it? And then if we just have strictly use data, it was used here, this amount, that may be all we get. Accurate versus approximate. Again, the more accurate we have, we can move up to getting, larger numbers, but our granular data realistically is going to be more accurate for us versus just aggregate data. Current versus historical. Easy versus resource intensive. Of course, we'd always like to be able to just go and say, I want your use data, or would you mind sharing your use data? And it comes in this pretty little spreadsheet with a bow on it. Then you can just look at it. And then we want to be able to look at these farms and help, why are you using this? We can benchmark within farms, but, why are you using this? What's your disease pressure? Are there ways that we could help improve your management or nutrition or anything like that to help decrease your use? But our reality is these two are more often than not switched. And so we can't get the current granular data that we would like without putting some resources into it. And so to kind of follow up with that, it also depends on what we're really going to ask for. And so if we're looking at just strictly amount used, again, it varies. We can have, we have the sales data that the FDA collects, and then we have potential to look at some farms that have individual animal, this also applies to herds or flocks. The duration, we're looking at the same type of thing, but when we start looking at regimen estimates, we're looking at potentially average weights with sales data, and we're kind of making an approximation of approximation, and that gets a little iffy on accuracy. And then the same thing with the number of animals exposed. We're looking at economic reports. We have a fairly decent idea of how many cattle we're looking at, but it just is going to depend on where you're at and the types of systems that you're looking at. And so, again, that kind of overlays with what I just went over. What we want and what we get sometimes can vary a little bit. The other point that I want to make is, while we can get the easy data, we also have to remember that it is approximate. And so, to be really, really simple, and this point's been made several times, the best way to optimize disease treatment is to not have to use that antibiotic in the first place. And so this is just a little schematic, kind of something that a lot of veterinarians and a lot of people will go through when they're discussing looking at disease and treating animals on the farm. It may not be a conscious thought process of going, 1 through 5, but realistically, we all go through this every time we look at it. So you start with your disease diagnosis, and your veterinarian, we're not going to be the ones that's always going to be treating every single individual animal. So we need to educate as much as we can and have nice, solid case definitions. Basically, we need to be able to educate our producers on when you see these signs. Here's some things you can do. What can we do to help this animal? And then, once you diagnose that disease, then you enter this fun little circle. And so we look, and is there a non-antibiotic alternative? First of all, is there one available? And then is it appropriate for this use? Is it efficacious? And the other thing we have to consider when we're talking about our proteins is this is a production system. It's a system we have to think about the affordability of these options for our producers, because if they can't afford them, they're probably not going to use them. And even if that's their only alternative, or unless that's their only alternative, and then we're looking at potentially losing those next year. If there's not one available, then we choose the appropriate drug for the disease, animal, all sorts of things like that we're looking at for these guys, while asking, why is this animal sick? What can we do to prevent it? And then continuing on, once we get to that point, do we still need this drug? If we don't, then we exit the circle and move on. And if we do, then we go through the circle again of, are there options that we don't know about, choosing the appropriate drug, and then working on our management. So these are just some of the options, and you don't necessarily have to pay attention to these, but these are some of the abbreviations that are used. A lot of times you'll see them frequently, you'll see them mentioned in use papers, especially coming out of Europe. Denmark and the Netherlands have their own systems that have some variation of these, and this is just a few of the options. So DDD vet is defined daily dose for an animal, and we have to specify that because it's used in humans. DCD is defined course dose, and you also see there's a DCD vet. PCU is a population correction unit. And as we look at these, each of them have their own very specific definition, and it can vary from place to place on how they look at that. And so, but they all have one thing in common, and that's that they require some sort of a estimation or an assumption of either use or dose, or weight at time of treatment, or all of the above on some of them. And so this is the way that we kind of prefer to look at it, and it makes a little bit more sense, at least in my mind. So what we see is we have our drug measurement options. Above the black line are numerators, and this basically is the amount of drug or the number of animals potentially that we're exposing. So we have drugs, which can be your total milligrams, your days of therapy, which can be a number of daily doses. So if you have a drug that's dosed every day for 3 days, that could be one of those. Your animals treated, so a number of regimens, and then your drug cost, which are sales data. And then, so the one that I will discuss just briefly will be regimens, and then on the bottom we have production, basically production parameters, number of animals, and then a time component. We'll look at, for the feedlot, and we're probably going to look at live weight, but you have the number of animals, and we also have the potential to look at pounds of live weight produced, or for dairies, milk produced, just as kind of a way to look at our use, and then either a time component of some sort. For us, it'll probably be animal days. For other systems, it may make more sense to look at per production cycle. And so to describe a regimen, we need these 5 things. So we want to know what product it is, the amount of product given, the number of administrations, the interval, so basically how often is it dosed, and then the route. And so we're just going to go through just a couple quick examples to kind of understand what I am referring to when we're talking about regimens. So tulathromycin is an injectable antibiotic used for bovine respiratory disease quite frequently in feedlots. And so the way our regimens would set up, this is all for the same weight of calf, all three of these examples. It's not the guy pictured. He's a little lighter or a little heavier than what we're talking about. But so the amount per administration would be 800 milligrams. It's given one time, and it's a single dose, and it's given sub-Q. And so you have a total of 800 milligrams. And I want you to just kind of keep the milligrams in the back of your mind for just a minute. So ceftiofluorohydrochloride, actually you have two dosing options for the same labeled drug. You can give 700 milligrams 3 times every 24 hours, so basically once a day for 3 days, and then you end up with 2100 milligrams. For the alternative dosing, you can give 700 milligrams for 2 doses, and this is on days 1 and 3. And these are all both on the label as appropriate doses for our animals. But with this one, we end up with 1400 milligrams. So what does the total milligrams mean? I like this picture because, so we have, if you go to the grocery store, you can identify you have X number of pounds of fruit. Okay? That tells us that they have some fruit, but we don't know what the makeup of that fruit is, whether it's all cantaloupe and watermelon or whether it's strawberries and grapes. And there's quite a bit of size difference in all of those, and that could be just something to kind of think about when we talk about total milligrams. If we're just strictly talking about use and we don't necessarily look at anything else, total milligrams may be an option, but we have to keep in mind some of the other things that go with that. So to kind of talk about a little bit of that, there's a lot of things that go into selection pressure. We don't really know, and I don't claim to be an expert in this, but when we're talking about selection pressure of antimicrobials, we have to consider the drug. We have to consider the class of the drug. We need to know the amount. Does a high dose once cause more pressure than multiple low doses? Or is it the total doses given? Again, we can look at the high or low, a couple high doses versus a lot of low doses. The interval, does it matter the total time that the animal is exposed to it, or does it matter the number of times that bacterial population is exposed? And then the route, whether it's oral, injectable, dermal. Obviously, there's others beyond that. And then we also have to consider the bacterial population within that animal that we're talking about also is one of the determinants of our resistance selection pressure. And then to kind of talk about this, if you think you understand antimicrobial resistance, it probably has not been adequately explained to it because we don't really know for specifics on what causes more pressure, less pressure, what's best. So then to kind of go back on what I covered earlier, we're still looking, it's still the question, what do you want to know? And that's going to be how your use data is going to work for what you're looking at. And so what question is being asked? Are we looking at resistance development? We're looking at resistance development in humans and animals. We're looking at the correlation between it. Are we looking to improve management? Nutrition, genetics, all of those things help us decrease our antimicrobial use when we do our best to take care of our animals. And so that helps decrease our use. And then antimicrobial use monitoring without considering your animal health is really nonsensical. If we're really concerned about animal health, we have to look at use tied to welfare.